Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Good.
Hi, this is Dr. Tom Rogers at Performance Medicine, coming to you with a weekly podcast on the Common Sense MD. Today's a special one because I have one of our amazing nurse practitioners, Bo McGregor, who has been with us for a short time, but he has a lot of experience in medicine. I want to talk to him about it. Welcome, Bo.
Hey,
It's
good
great
morning.
to have you
How are
here. I'm doing great today, and we've talked about doing this for a long time. The first time I met you, I knew you were the right person for our practice because immediately I can tell if somebody's kind of on board with the way we look at medicine and how we practice. In my mind, it's such a higher level, especially for things that are primary care. And then we do a ton, as you know, with obesity management, hormone evaluations, and autoimmune diseases. And I think we're just better because we have more time to listen to our patients, and we're not encumbered by some of the things regular practitioners are, like insurance coding and things like that. So,
Oh, yeah.
In any event, tell me a little bit about yourself, your experience, and all. Your father of 3 wonderful girls and lovely wife, and you've had a lot of experience. Even though he looks like he's about 30 years old, how old are you, Bo?
I'm about a year and a half away from hitting the 5th floor. So,
You look great. I tell you, you are aging well. For an anti-aging practice, you're the face of our practice. So I
no
want
way.
to tell you thank you for joining us, and it's been just a blast working with you. And you're one of our forethought leaders in our organization. So tell me a little bit about your background.
Well, I mean, it's kind of funny how you end up in the places that you're probably meant to be. And sometimes you take a long road and you find yourself always searching for something else. You think you want this one thing and you keep searching, keep searching, keep searching. And then when I've had some friends tell me, even, tell them what I'm doing now, and they are like, I think this is what you were always supposed to be doing. Um, Always been interested in nutrition and exercise, even as little, even as a younger kid growing up, especially as a teenager and things, and probably was doing the wrong things because we were told to do the wrong things back then with, low fat diets and whatnot, but doing what we were told. And then kind of getting into the medical field. As a nurse, I was with critical care for a long time, and I knew that I wanted something more than that. Even though I had a great time, learned a ton, went back to school, got a job with the hospitalist critical care group in Knoxville, and I knew most of the doctors from working in critical care anyway. Did that for a long time. I really liked the really, really sick patients. I liked kind of that high level of medicine to where you're kind of either, and you got a lot of satisfaction from it because people sometimes got better really quickly with really quick interventions. And that's what the gravitational pull of critical care, I think, is. And did that for a while, switched over to ER, learned a lot, learned a ton, but knew that that wasn't really what I was supposed to be doing. Went back to critical care because that's familiarity, and ended up even at UT, which is even kind of the highest level here in Knoxville of critical care. A great team, but as I was in it for a long time, I always tell people the everybody began to be so sick, and especially after the COVID and everything like that. And you're like, I would always joke around and be like, well, not joke around, but ask them like, where's just my normal septic shock patient that I can get better in a couple days? Because that's the instant gratification with quick interventions, and that's what drew. They didn't exist because everybody is so sick. Then you start learning things, learning different interventions of why we are sick. And your phone feeds you things that you think about, and kind of going down different pathways of what can I do personally to be healthier, reduce stress, eat better, try to exercise more, because what I'm seeing in the hospital is not where I want to be. And then kind of looking into more of this integrative health, nutrition, read Good Energy by Dr. Casey Means, and it's like, wow, this is a different thought process. There's a guy, he's online, Dr. Living Good, I think is who he is. I read his book too, and I was like, huh, everything's connecting. Because in regular medicine, especially in hospital medicine, everybody gets put in a box. Like, you got this specialty, you got that specialty, and kind of they don't intertwine a lot of times. Um, and then, I asked my wife, it's like, is there anybody around here in Knoxville that does this kind of stuff? And of course, she had heard of Robin over at our West Knoxville office, and she messaged her through social media, and Robin got back to us, gave us Andy's contact, and I contacted Andy and met you guys, and ended up we knew a lot of the same people, given that you were a practicing physician in Oak Ridge for a long time, where I grew up.
Yeah.
So,
It was
and
fate.
here we are.
It was just fate. Your story about ending up where you're supposed to be. It's kind of like my story as well. A couple watershed moments for me. Really, when two of my kids came down with type 1 diabetes, I realized right then that I didn't know anything about nutrition. So I started digging into it, and I learned that they taught the wrong thing, the exact opposite of what you're supposed to do. Even the dietitians were teaching it wrong. So it led to one thing to another, to integrative medicine, and that was when I decided to get out of traditional healthcare system, because it was burning me out. I was seeing too many patients. I had about 7 minutes with each patient, not enough time to prevent anything, just to put them on another medication. So that was number one. Number two was really COVID. And when COVID
Yeah.
hit, I really realized that I really think God put me in a place where I could treat it. And because I was treating outside the box, because the regular answer is, you have COVID, if you can't breathe, come back to the emergency room and put you on a ventilator, which killed people.
Yep.
And so COVID really cemented the thought in my mind that this is where I'm supposed to be. And if not, I think I became an MD really for the sole purpose of treating those COVID patients. And so I'm in the right place too. You're in the right place. I appreciate you coming on board and being almost the face of our organization right now, because you're a very trusted individual, and that's why people see us. They trust us, and they don't trust the medical system the way it is now. So we're outside the box in that regard.
And one of our thing with our patients too, they're so smart. I learn stuff from them every day.
Of course.
But just because a lot of them come in with a different mindset, where they've done their own research already, to where they're not just coming to us for all the answers, and haven't done any of the work either. Because and I think that's kind of been a mentality too. It's like the doctors, right? They're just going to tell me what to do. When we know now, like especially nutrition, you hear all the physicians talk about, what was the nutrition class in medical school? There's not really one, right?
So it was about an hour. I think we had 1 hour lecture, and it was totally the wrong idea. At that time, they were proposing the low-fat diet, which is terrible. But we're in the right place. We have a chance. Our patients are more knowledgeable, and it's challenging because they challenge us. We learn as much from them as they do from us. But one thing we do, we have time to listen and work with the people, because in my opinion, the patient has the ultimate authority over their own health. That's what I try to preach. But in any
We can give
event,
recommendations, but they get the final say so.
that's exactly right. So you mentioned, when I told you I wanted to do this podcast with you, you mentioned a couple things you want to talk about specifically today. And I think it's testosterone and terzepatide.
Yeah, the two T's.
Yeah. Two great tools that we have in our armamentarium that are just amazing.
Well, I mean, and you've talked about it multiple times, especially about testosterone, about all the bad things it was going to do. And, I've listened to a few things about hormone replacement, hormone supplementation, men and women, and about like, what for traditionally for a long time, what physicians were taught is hormones are just bad, right? And that was all the talk of it. Like they weren't taught that they weren't taught how to use them. They weren't taught what was good about it because with all the studies that were proving way back when, and now things are being disproven. That kind of had a whole generation of physicians that kind of don't know how to deal with it and don't want to deal with it. And you get referrals all the time from PCPs, right?
Yeah.
Say, go see Dr. Rogers down there. He knows how to do this stuff.
Yeah.
And now it doesn't testosterone doesn't cause prostate cancer, and actually if you have low testosterone actually increases your risk because I kind of think your overall health status is lower, right?
No
You
doubt. No doubt.
have less muscle mass, you have less ability to gain muscle and improve on muscle mass. Has been disproven to cause heart issues that you have posted about.
They've
What is
taken the
that? The
black box
Traverse
warning off
study?
that. Yeah. They
Was
took
it the Traverse study? Yeah.
Traverse study. They took the black box warning off of testosterone as far as heart disease is concerned. But a
Mm-hmm.
lot of it's education. I mean, a lot of the cardiologists don't know that yet.
Mm-hmm.
And, you have to really almost educate the doctors because
Yeah.
if they say something bad about it to the patient doesn't know what to think. And so they come to us because they trust us and we've done our research and we've got all this experience with, testosterone in the past. I talked about Dr. Marty Makery, the new head of our FDA,
Mm-hmm.
getting on
Oh,
the
he's
morning
awesome.
show, talking about women's hormones, bioidentical hormones, how
Yeah.
great it is for them, how it's way more effective. Bioidentical estrogens are at preventing heart disease than statins are. I mean, who knows that as a physician, but it's way, way more protective for your heart. And yet people think, well, this may hurt my heart or cause a blood clot. It doesn't. We're using creams and pellets. We're not using oral estrogens. But
Yeah.
in any event, the one thing that I wish you would have noticed was or mentioned is that women need testosterone just like
Oh,
men do. That's the one hormone, male or female, that really makes you feel better.
that and I have a friend. She's mid 30s or whatever. Had her hormones checked by her OB, and it was she told us that you have a testosterone of an 80-year-old lady, but if I give you any, you're going to grow hair on your chest. I'm like, that's just fearing the patient because you don't know how to treat
Yeah, yeah, totally
it.
false. Totally false.
and
Doctors
it,
tend
what
to poo-poo what they don't know much about.
hmm
They
and
dismiss
that's
it.
okay. Like, but don't fear somebody. Be honest with what you know how to treat and what you don't. Because I think we are. Like, if I don't know that much about something, I tell the patient like I would have to look into it and
Yeah,
see because I'm not really up to date on this.
yeah. Know when to refer. Like if
Hmm.
somebody's has a grade 4, 3 or 4 renal problem, you're gonna send them to a nephrologist.
Hmm.
You have to take advantage of all the specialists. But anyway, in my opinion, we are experts and specialists in hormone evaluation management and also metabolic syndrome,
Yeah.
weight loss. So we've got great testosterone. Now we have this amazing once in a generation lifetime medicine called Terzepatide. Of course, Ozempic, semaglutide was the first one that came out. Now we have one that's even better. And in my opinion, it's a life changing medication. It's really the only, like I tweet out, it's the only medication I've seen in 40 years of practice that can change the human condition. It's almost like a
Yes.
weekly dose of accountability because
Hmm.
people that are obese, they don't have much of a chance of getting lean without some help. The
Hmm.
willpower thing is there's really no such thing as lifetime willpower. You're going to
No.
revert back to your metabolic state, and this changes it for all the great reasons. And then you got all those positive side effects like less heart disease, less dementia, less strokes. How have you seen this Terzepatide play out in your practice?
I mean, it it does work. It works in many ways. And sometimes when people are on these medications, even they might not have extreme weight loss because kind of you don't want the extreme because you're going to have a lot of lean muscle, lean mass loss in that extreme. I saw a girl last week, I think so. She she's been on it maybe 4 or 5 months, and has lost maybe, I don't know, 10, 12 pounds, but she looked great. Like, just, and I told her, I was like, you look great. You look very different from when I saw you. And I think a lot of it is just she's happier, decreased inflammation, she feels better, and she's on the right path. Um, and the right path is kind of really what we kind of wanted to talk about here. Now, is the drug a little magic for like low dosing for migraines and things like that, joint pain? Absolutely, because it's kind of wild how all that's working, and that's amazing. But for people to come in here to, I like Trump said, the fat shot. um, it it doesn't just work like that. You still have to put in the work, and you still have to have a plan moving forward. I think it does give a little medical accountability to the person because it can turn off what we call like the food noise, but you have to want it to because the brain's pretty powerful. You have to understand that what kind of food choices you need to make to help this tool that you have now to lose weight. You have to, well, I loved this term I heard the other day. Everybody in typical America has energy toxicity, energy as in calorie toxicity, and it helps decrease that energy load and turns off the food noise and then making correct decisions in what you should be eating.
That's
Like
exactly.
I tell everybody with my experience with it is my food noise was once the kids get in bed at night, vegging out on the couch with my wife for an hour or so before going to bed, go to the pantry, looking in the pantry, ooh, cookies, something like that, to where it became like, I don't know if I'm that hungry, but I'm gonna eat this beef stick instead.
Yep, yep, yep.
That's the accountability part. I think is where the food noise comes into be able to make better choices, but you have to know the choices.
Yep.
We kind of go into a big spiel about increasing your protein intake, and when we talk about it, people's eyes get really big because protein has been lost as a subject of our diet to where we're like, hey, you need to be getting 30 to 50 grams of protein at your first and last meal of the day and kind of pushing to almost a gram per pound of protein a day, a lean mass poundage,
Yep,
not
yep,
where you are, where you want to be.
yep,
And people's eyes are like, oh my gosh, that's a lot of protein. Like, and it's difficult because people have never thought about it in this way. Everybody's been thinking calorie, 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 calorie.
yeah,
And I tell everybody, it's like, if you get the protein in, everything else is fill in the blank because you're going to be full.
yep, yep. Exactly. Protein, I call it's the currency of aging.
No.
You have to with muscle because protein
Mm-hmm.
builds muscle. So most Americans do not get enough protein,
No,
and
no, not at all.
this medicine like Terzepatide, it just gives them a chance, and they're so excited when I realize, hey, I can actually lose weight because when the doctor told me the way to lose weight is just eat less and exercise more, and it didn't work. I joined a gym, nothing happened. I tried my heart out, and I lost two
Yeah.
pounds. And here I am at 280 pounds. These people have a chance. And along with it, like you say, goes education on
Yeah.
what to eat, how to work out.
And if nobody's been to the gym before, you can't tell somebody just go to the gym. Like they're just going to walk in there and be intimidated and not know anything to do, and nothing gets done. There's nothing accomplished. So kind of it's like little baby steps, and people. some people that get put on this, like, I've only lost 10 pounds in a month, and so lost this. And I was like, well, 10 pounds in a month is pretty extreme. I mean, that's
That's good.
good. And if you actually lose it slower over time, you're changing lifestyle habits.
Yeah.
And that's kind of the real goal of all this. And it's, like you said, the medical accountability that we're using during this process. And it can better regular biomarkers and things like that and improve overall health because, the more physically fit and the cleaner you eat, your overall health status improves. So,
When you take these people that do a Cleveland Heart Panelist before getting on that, if they're one that needs it, then afterwards it's incredible to see the differences in it, to me.
it's kind of the same thing, like going back to testosterone a little bit. I think sometimes it does have a little bit of magic with your brain, especially women.
Yeah, yeah,
And the people feel better, but people that are wanting to really improve muscle mass, just taking a testosterone shot's not going to magically do it.
yeah, yeah.
Like you got to get down and you've got to move some weight, whether it's your body weight or if it's like true resistance training. You've got to put that work in. Use the tools that have been given to you, that has depleted over time, that you used to have when you were 18 years old, and that was easy then. But you can't expect just to take a shot of testosterone and all of a sudden you're going to Hulk out on everybody.
No, no. People have a lot of misconceptions about testosterone. You saw me back there doing
Yeah,
push-ups,
yeah.
this morning before our little early morning chat here today. You have to
Well,
do it, and it's good for you.
yeah, and people, like, you don't have to, like, the people that are kind of workout naive, I guess. You don't have to go to the gym. I tell people that have never really done anything, I'm like, get online and look at body weight resistance training for beginners.
Yeah,
And
yeah.
your phone will give you numerous exercises to do. And they won't be hard. And 20 minutes starting out a day, and you'll see improvements, especially using the two T's:
That's right.
testosterone and
I love it. I
terzepatide.
love it. The two T's. Your older body, like I am, I'm 70 years old, will thank your younger body by doing this early. What we're trying to do in our practice is look ahead 10 to 20 years as to what that person's going to look and feel like. We're trying to prevent
Absolutely.
them from going on all these medicines they never needed in the first place.
No, and that's our goal, right? Is to get them off all the medicines,
Yeah, yeah.
because they don't need them, because they feel great and everything looks like it's headed into the right direction. I saw, and is all this stuff hard to try to eat clean, whole foods, kind of, because you kind of got to prep it out. It's not grab and go like most our society is. You have to think about it, and to get up and do those exercises, to do those push-ups you were doing this morning. It's easier just to get up, have your cup of coffee, sit in front of your TV, have your dessert for breakfast like most people do. That's easy.
Yeah.
I saw a quote this morning. It was, making excuses today makes tomorrow harder, but making today hard makes tomorrow easy.
I love that. That's a great one. That's a great one. You got another quote about putting the work in. What was that?
I can't remember. I should have wrote it down.
Yeah, that was a great quote about, you have to do it's like if you do take testosterone or tirzepatide or peptides or anything that we use, supplements, vitamins, we believe in it all, believe me. You still have to put the work in. And just
It's
make the
not
work fun. I love doing push-ups. I love stretching. I love walking. I love biking. I love pickleball. If you come up here, I'm going to give you a dose of pickleball. You're not going to
well.
be happy, but
We had friends over last night. It was my daughter's birthday, and he showed me, the old tennis place over in Carnes.
yeah, yeah.
So now it's
Oh,
a big pick.
pickleball. Yeah,
Yeah, they've got pickleball. They've got a golf simulator up there. They've got a full all out lounge. It's. He was showing me a video of it. I was like, okay, we could probably do that.
we have all the tools now that we need in a lot of things. We just need to, and yet our country is becoming fatter and more unhealthy. It's unbelievable the opportunities we have now to stay in shape and live longer, healthier, yet we're not. So I hope our practice kind of helps people that are interested in this and motivated to do this to get better and to live a longer, healthier life. And you're certainly, a leader in that. And I'm so appreciative of you being in our practice.
I'm appreciative of being here and giving me a shot, basically,
Oh man,
at doing this. This is. I mean, it really is fun. It's fun to
don't you
try to
enjoy
help people
medical practice?
improve.
Don't you enjoy coming to work?
Mm-hmm.
I'm the same way. I
And
like your noontime walks with Bo. Is that what you call it? I was walking a little
I haven't done
easier.
any of those in a while. I like when my kids ask me the questions. Those are pretty funny. I had Katie ask me the question about the raw milk the other day. And I didn't get to the farmers market yesterday, but I'm going to try to get that lady's information of how can we get in contact with her and see how she does everything too.
I've got some raw chocolate milk in my refrigerator right now. I'm getting ready to go drink a little bit of.
I was trying to tell my 6-year-old that actually came from chocolate cows, but she didn't believe me.
It's good. Well, Bo, I know you've got to work. Thank you so much for coming on here and talking about the 2 T's and in general your philosophy about how you need to age well and stay healthy and fit and off terrible diets, off the couch, and hopefully get off of some of those medicines that you just don't need that people take every day. But I
Or
appreciate you being a
at least
passionate.
figure out if you need the medicine,
Yeah,
right?
yeah. I take people off medicines every day, and they feel so much better. Give them a few tips on how to eat. Give them the tools if they need hormone replacement therapy or a little help with something like Terzepatide that turns their life around. I had a lady, as a matter of fact, this week that came into me several years ago. She weighed 330 pounds. She's now
Oh,
under the magic 200 pounds, and she told me that she had a quote. She says, "I feel normal again." And I
wow.
really liked that because she felt abnormal being 130 pounds over what she is now, off her medications. But I love that I feel normal now. And she's on
Yeah.
Terzepatide. She was the ones freaking out because her insurance, Terzepatide is Zepbound, her insurance was forcing her to go off that onto Ozempic or Wegovy, same thing.
Yeah.
So they don't realize this is a totally different medication.
It's not the same.
So no, it's not the same. And so if you're struggling with that, we can find a way to get you the compound, whether it's branded, your insurance covers, we're going to get you the branded. If not,
Yeah.
or we're using it for other things like microdosing, which I use, then the compounded Terzepatide is amazing. So it's fun to see that kind of patient that you've helped along the way.
Yeah.
Um,
And people, some people are a lot of people that are in her position don't understand that you deserve to feel good. And I think that a lot of self-positive talk to people that they need to tell their brain, I deserve to feel better than I do.
that
And
is
I
a
think that gets in the way of a lot of people.
That is a great point. You deserve to feel better than they do, which they do.
Yeah.
Another quote from Bo McGregor. I've got a whole book full of them. Thanks, Bo. I know you're busy. You have to
Thank
get to
you.
work. Thank you so much. And guys, we'll see you next week. Stay tuned.